Please tell us about your candidate's health care plan.
I think it's great that we're asking this question tonight when the California health care plan looks like it went down to defeat today in the state Senate. And on the heels of what I said from my office, winning defense of San Francisco's health care plan that has made us out of the
For that you can applaud.
So, don't take that for my time, but I wish it was something, I'm hopeful that it's something we're going to be able to accomplish on the national scale, because the fact of the matter is that there are nearly 47 million Americans now, roughly 16% of the population are without health insurance. That's 7 million more than were uninsured at the end of Bill Clinton's term in 2000. And I think as much as anyone in America, positive and negative, I don't think there's anybody that has as much familiarity with what it takes to put together a health care plan than Hillary Clinton. And I think we can all agree that most Americans would be a lot better off had the Clinton health care plan been pushed forward in 1993. And I'll say that since then, Senator Clinton has been instrumental in creating the Children's Health Care Insurance Program, which now covers 6 million children. And she has the strength and experience to know what it is that we need to do as we move forward over the course of the next decade. And her plan sets out 3 principles that are guided by making sure that we have an affordable plan, an available plan, and one that is reliable for all Americans. And I think it's important to note that her health access plan that she wants to put forward is based upon ensuring that American choices are there to pick from a public plan, options similar to Medicare, in addition to a broad array of private options that would ensure that all Americans are able to get the same kind of health care that members of Congress can pick from now. And a big part of her plan is ensuring that we provide tax credits for working families to help them cover their costs, and a guarantee that working families never pay more than a limited percentage of their income for health care, that we do whatever possible to ensure that people are not rejected from health care coverage based on pre-existing conditions, and that their health care coverage will be portable, enabling people to keep their health care coverage and take it from job to job in the event that they make that change.
What you'll notice is a recurring theme this whole evening. John Edwards came up with the first and the strongest health care plan. It's a universal health care plan, and I want to thank Dennis very much for describing John Edwards' health care plan. 9 months after John Edwards offered his health care plan, Hillary Clinton adopted it almost whole cloth, with one major exception that I'll get to that makes her plan, sadly, much weaker. But the issue is John Edwards' health care plan is a universal health care plan that's completely paid for by rescinding the tax cuts, the George Bush tax cuts on individuals who make over $200,000 a year. The other candidates on the stage also have health care plans. There's only one candidate on the stage, though, who does not have a universal health care plan. Senator Obama's plan would leave 15 million Americans without insurance. The question, of course, is, what is a Democratic candidate offering a health care plan for that does not provide universal coverage? Which 15 million Americans don't deserve health care? The entire working population, the entire adult working population of California? None of them. That's 15 million people right there. Senator Obama has said that he doesn't support universal health care because he doesn't believe in mandates. His plan does have mandates. For children. He says mandates don't work. If they don't work, why do we have them for children? Secondly, he says he'll have a plan that's lower cost. The problem is, we all know, health insurance, like any insurance, works by bringing more people into an insurance plan. By leaving 15 million Americans out of the insurance plan, the cost will actually be higher, access will be less affordable. And with regard to Senator Clinton's plan, sadly, it doesn't provide for small employers to have coverage for their employees, which means, again, that working families are going to bear the brunt. It's going to create an unfair playing field for small corporations, because many of these small corporations won't offer insurance. So John Edwards, again, has the strongest and the first universal health care plan.
Thank you. For Senator Gravel, universal health care is a must. We all deserve it. We're one of the superpowers of the world, yet we can't insure our people. We can't give proper health care to our people. We're #1 in spending on health care, and we are number 37 in the world as far as delivering health care. Where does all that money go? You might say insurance companies, you might say big pharmaceutical companies, and you're right. Under a Gravel administration, there would be universal health care that would be paid through a sales tax. By having it paid through a sales tax, it takes the burden off of corporations that are becoming uncompetitive in the world by having to bear the brunt of the employees' health care. So again, it would be universal health care coverage paid for by a sales tax. And with respect to another great plan that was that unfortunately we won't be able to see, Dennis Kucinich. I just want to say a brief word about Dennis Kucinich and his single-payer health plan. I wish we still had him here with us because he is an amazing, brave fighter for what the people truly want. And unfortunately, mainstream media and the corporatocracy that we live under, I know everybody would like to believe it's a democracy, but it's a corporatocracy that we live under, marginalizes people like Dennis Kucinich and my father, Senator Mike Gravel. And what we need to do as the people is to take back that power and again, vote for yourself to be empowered so that you can vote on the issues. So take a look at nationalinitiative.us. The abbreviation for it is www.ni4d.us, and learn how you can start voting on the issues. And again, universal health care, we all deserve it. In 1947, Harry Truman was saying that we all deserve universal health care. Why is it that we've still not had it, even though it was described to us in 1947?
Before I rebut Jeff's assertions, I just want to say that I think that Lynn is really speaking some profound truth. Thank you very much. And also, let me just take a frame of reference here. The fact that 9 million children in the United States, 47 million Americans are uninsured is immoral. I am sick and tired of hearing Republicans who we will all have to galvanize against at one point, talking about the perils and dangers of socialized medicine. You do not hear them talking about socialized education, socialized garbage pickup, socialized highway system administration, and our socialized military, which will moral values that we bring. Look, Jeff, the fact is that Senator Obama would vigorously reject your assertion and your calculus that 15 million Americans would be somehow uninsured in his plan. His plan is very clear and very delineated that all Americans would have access to insurance. The goals that we all share on this podium are to ensure providing universal coverage for all Americans. The modalities and the ways that we've envisioned how we do so, though, are different, and there are reasonable differences. Senator Obama has been very clear that we can provide to the 45 million, 47 million uninsured Americans coverage, and we can do so on the same basis that we provide coverage to federal employees, congressmen, and our president. That we can do. For those Americans who have coverage already, we can provide for them a methodology for allowing their premiums to be lower. These goals are not impossible, and they are not incompatible with other plans that involve mandates. The key issues, though, are what do we do on a deeper and more fundamental level? Senator Obama has been very clear. First, we reduce costs of our overall healthcare system by the U.S. government picking up more of the tab for the most expensive illnesses and conditions. Second, I have to stop it. Let me just say one last point. I can go through the plan and you can see it as well. But one thing we need to do is take on the drug companies, take on the insurers. The fastest growing part of our healthcare system is the profits they are earning. It's reprehensible, and we all have to do something about it going forward.
Our fourth question. What does your candidate believe of the United States' role should be in the Middle East peace process?
I think among the biggest failures of the Bush administration has been its abrogation of leadership in the quest for peace in the Middle East. And the fact of the matter is that George Bush has turned his back on the problem and avoided bringing American leadership to the table until the very last hour of his administration. It is imperative that the United States take a leadership role in helping to bring about peace in in the Middle East.